Okay, so I'm giving a persuasive speech today about medical marijuana. I don't know how many of you agree with medical marijuana. All of you? Everybody?
I definitely agree with it.
So doing this research, there's actually a lot of information I didn't know that, I mean, I agreed with it before, but now I totally think it's right. It's actually legal in 20 states right now, and I feel like it's eventually going to be an option in all 20 states, so everybody needs to be educated on it. So medical marijuana is important because in this day and age it's nonsense to oppose the use of marijuana when we're in the midst of an opioid crisis. Everybody knows how big the opioid epidemic is everywhere. Marijuana is actually used to replace opioids in chronic pain patients or used in conjunction with. So they think if more patients use medical marijuana, we will have less opioid addiction, opioid overdoses. So there's many conditions that medical marijuana can help. I've listed a few, cancer being one. Many patients who suffer from any form of cancer have symptoms that are uncontrolled by prescribed medications. Studies have shown that medical marijuana can help nausea and vomiting that's caused by chemotherapy. Patients who use medical marijuana often need less pain medications. And some animal studies have also shown that cannabinoids can slow the growth and actually reduce the spread of certain tumors. Marijuana and chronic pain. Again, 1 in 5 people in the world suffer from chronic pain. Marijuana is an effective painkiller for many conditions and can be used in place of or in conjunction with to treat pain. And in 2015, the Journal of American Medical Association found that cannabis used for chronic pain and neuropathic pain is supported by high-quality evidence. Therefore, they're likely effective for these conditions. Medical marijuana and epilepsy is another condition that treats. I was kind of shocked by this fact that 34% of childhood deaths are caused by epilepsy or accidents that occur during an epileptic seizure. Seizures and seizure disorders are unique to each person, so it makes it hard to treat because, you know, it's a problem with your brain, so everybody's brain is different. It's hard to find the right balance of medications. Recently, the FDA has approved a medication called Epidiolex, and it's a CBD-containing medication that is actually beneficial on patients that suffer from epilepsy. Medical marijuana is also used in mental health. Patients use medical marijuana for PTSD, anxiety, depression, ADHD, bipolar disorder, and even schizophrenia. CBD has been shown to treat symptoms of schizophrenia in clinical trials that are the same, comparable to the same treatment that antipsychotics give. And the National Academy report acknowledged that there's moderate evidence between cannabis use and better cognition performance with people with psychiatric disorders, which I thought was interesting. So everyone questions, is medical marijuana safe to use? 2 million Americans have a prescription painkiller substance use disorder. Opioid pain medications are closely related to heroin. They're highly addictive and may have severe withdrawal symptoms. Opioids have a high potential for overdose. The amount required to manage pain gets, you know, we build tolerance, so it gets more and more. So you come close to a lethal dose, the more used to it you get. Drug overdose is the #1 cause of accidental death in the United States, and prescription painkillers are the #1 cause of drug overdoses. Research suggests that, again, marijuana can replace these opioids, which would lead to a decrease in our overdoses. And marijuana is also thought to reduce the development of an opioid tolerance. Everybody knows when you prescribe many medications, there's interactions. I mean, how many patients have we seen here that had interactions between certain medications that the doctors weren't even aware would happen? So people take numerous prescription medicines for different conditions that are all diagnosed by different doctors. Sometimes they don't all get together and figure out, you know, so there's multiple side effects and interactions between medicines. Physicians might not even know what happens, and unknown of any interactions that have happened in the past. Side effects of marijuana are minimal, and they include increased appetite, dry mouth, euphoria, and a slow sensation of time. And as I said before, drug overdose is the #1 cause of accidental deaths. There's no known lethal dose of marijuana, meaning it's impossible to overdose from using marijuana. Prescription pain medications, people develop tolerance to those, leading to larger and larger doses being prescribed, and then that increases the risk of overdose. Marijuana withdrawal. So there is no actual withdrawal from marijuana. Unlike nicotine, alcohol, and other hard drugs, there is no withdrawal syndrome, which is the hallmark of a true addiction. So when you stop using marijuana, you don't go through any withdrawal, which I found interesting. Marijuana is the second most used drug in the United States, but only 9% of people who use the drug develop a dependence on it. And there is scant evidence that shows marijuana carries any risk of addiction. Unlike cigarette smokers, most users do not use the drug on a daily basis and abandon it in their 20s and 30s. And there's also a question if marijuana is a gateway drug. Many people think that this leads to using harder drugs, but it has never proven to be true. Scientists have no evidence that marijuana causes people to use harder drugs after decades of research. Among drug users, most of them do not start with marijuana. They rather start with alcohol or nicotine, and there is nothing in marijuana that leads to the use of other drugs. And then finally, there's been no fatalities from marijuana. Everybody says no one's ever died from smoking marijuana, but that's actually proven to be true. Nobody has ever died from smoking marijuana. Again, our nation is in such an epidemic right now, and building up tolerance to opioids is only going to lead to increased overdoses. Marijuana, you know, it helps all these people with all their symptoms, cuts down on the opioid dependence, and I feel like it would only better our nation and everybody's individual lives. So I highly approve of medical marijuana.
Me too.
You can show again. Show the class.
And actually,
Thank you.
started showing